You don't even have to take a drink to destroy your liver. In fact, the most common liver disease in the United States happens without a drop of alcohol, and most people don't even realize that they have it. 1 in 3 adults, let's just let that sink in. 1 in 3 adults has fatty liver disease. And the first warning isn't a bellyache or yellow eyes. It might just be your triglyceride level. So let's talk about NAFLD, or non-alcoholic fatty liver disease. It's the silent epidemic that is destroying us from the inside out. But the good news is, if you catch it early, it's reversible. Again, NAFLD, or non-alcoholic fatty liver disease, I'm just going to refer to it as NAFLD now. It'll save us a long time on this video. It happens when fat accumulates in the liver cells without alcohol consumption. Now let's compare that to AFLD, alcoholic fatty liver disease. You get the same results: inflammation, scarring, and even cirrhosis, but there's different root causes. NAFLD is really driven by insulin resistance and not alcohol. And because it's not involving or tied to drinking, it's often overlooked. There are so many things that the liver does. It's not just a detox organ, it's a metabolic powerhouse, and it does over 500 jobs in your body. And here are just a few things, kind of in broad categories, that the liver does. It helps to balance blood sugar and insulin. It produces bile to help digest fats. It metabolizes the three big macros. It filters toxins and medications. It stores vitamins and minerals. It breaks down hormones and red blood cells. It manufactures cholesterol, which we really do need cholesterol because all of our cell membranes are made up of cholesterol, and our brain needs a lot of cholesterol. And so it manufactures cholesterol and triglycerides. So when your liver is inflamed or overloaded with fat, and I mean literally it starts getting fatty, it's infiltrated with fat, all these systems start to break down. I want to bring up a topic about high fructose corn syrup and alcohol and how they both harm the liver. We know people, we may know someone, and I know I treated a fair amount of people as a physical therapist in end-stage liver failure. It's really a sad ending for sure. But what alcohol and high fructose corn syrup have in common is they both get processed by the liver. They go immediately to the liver. And alcohol is so toxic to the liver that it takes oxidative priority. So if you have alcohol with carbs, fats, and protein, it's going to prioritize alcohol to get it out of the system before it breaks down anything else. So I always say that pizza and beer, that pizza is getting stored because the liver is prioritizing the beer. Excess fructose in your body and in your bloodstream is converted to fat, and that causes triglyceride buildup, oxidative stress, and inflammation. And it's the same pathway as alcohol-induced damage. They're the same. The liver treats them the same. So that soda habit you have, that big gulp, it's more like a cocktail to your liver than you even think. So the incidence of NAFLD, we said, is 1 in 3 adults in the US. So 33% of adults in the United States have this disease. To me, that's pretty much an epidemic. And in people with obesity and type 2 diabetes, that number jumps to 70 to 90%. So if you already have type 2 diabetes, I would put money down to bet that you have a fatty liver. And get this, it is now the #1 cause of transplants in women. So what causes NAFLD? At its core, NAFLD is caused by insulin resistance. Add to that high fructose corn syrup in foods, seed oils, processed carbs, a sedentary lifestyle, chronic stress, poor sleep, and your liver is under siege. The liver makes triglycerides from excess sugar and excess fructose. So high fructose corn syrup is a sweetener derived from corn. It's a combination of fructose and glucose, and usually it's about 55% fructose and 45% in soda. And in baked goods, you have about 42% fructose. The reason why these food companies are using it is because it's cheaper than sugar and it's used in everything from sodas and salad dressings. It's found in processed foods, sweetened drinks, ketchup, breads, cereals, etc. It is pervasive through processed foods. And again, it's cheap. So it's all metabolized in the liver. Now in the US, the standard American diet is made up of 60 to 90% of processed foods. So no wonder we have this epidemic. High fructose corn syrup is also metabolized in the liver, and when overconsumed, it has the similar effects of alcohol, and liver fat accumulates, you get inflammation around the body, and you increase insulin resistance. Let's take a closer look and compare fructose with high fructose corn syrup. So fructose is natural. It's found in fruit and honey. And one of the big things that's different is that it does come with fiber usually in nature in its natural form, and it also has nutrients. So it means there's some benefit. Small amounts are harmless, but that fiber, what it does is slow down the digestion. So you get less of a sugar spike. You still get one, it's still a carbohydrate, but it slows it down. So less of a sugar spike and less of an insulin spike. And it's hard to overeat in nature. Okay, now let's contrast that with high fructose corn syrup. It's found in processed foods and drinks. It comes with nothing but empty calories. In large amounts, it is harmful. It's rapidly absorbing. That's the real key. It's going to give you that glucose spike, and it's going to give you that insulin spike. And it becomes addictive because you really become a sugar burner. And it's easy to overconsume in the modern diet. So with NAFLD, it gets overwhelmed and starts flooding the bloodstream with triglycerides. And again, that's your first warning, even before your liver enzymes go up. That means high fasting triglycerides, low HDLs, they're the good cholesterol. It increases the small, dense, low density lipoproteins. They're the more dangerous fats. And the smaller ones. That means they're staying in your system longer, and they get smaller and smaller, and they can do damage. They can get into the vessel walls. So here's the kicker. Triglycerides may rise way before your liver enzymes do. So that's the real warning sign. That's the whisper from your liver. So your cholesterol panel could be waving the red flag long before you have higher liver enzymes and before your doctor even thinks to test for your liver. So what happens when you have NAFLD? The fat builds up in the liver and the liver can't function normally. The detox starts getting sluggish, hormones kind of go haywire, fat burning and metabolism stall, hence you're putting on more weight, and then inflammation spreads because it promotes visceral fat, and that visceral fat leaks inflammation into the bloodstream. And I'm going to recommend, if you haven't watched it, watch my video. It was the one I just did before this on inflammation. I think it's key It's present in every chronic disease. So I think the better understanding you have of inflammation and all the damage it does to your body and your different systems in your body, you'll be more likely to be able to make changes to improve your health. So NAFLD and type 2 diabetes are connected. They're really two sides of the same coin. Both are caused by insulin resistance. NAFLD increases your risk of developing diabetes, and diabetes makes your liver more fatty. So it's a dangerous feedback loop. But here's the good news. You can break it and reverse it. I did. So let's talk about some of the signs and symptoms, not your labs, but some clinical signs and symptoms that give you a clue that you might have NAFLD. One, you may not feel any pain, but your liver does whisper, as I said. You may have fatigue or brain fog. You'll have bloating or fullness in the right upper quadrant of your abdomen. You'll start getting dark folds around your neck, under your arms, or skin tags. And it's not a coincidence that these are also clinical signs of insulin resistance, because remember, two different sides of the same coin. So those dark neck folds and skin tags, and then weight gain, especially the visceral fat. And think of the term beer belly, the people we know, and they have that big protruding hard abdomen. A man does, almost like a pregnant woman's belly. But initially, it's all, again, it's more subtle. And as time goes by, it gets worse. So don't wait for jaundice. By then, the damage is well underway. Okay? And you're on your way when you have elevated liver enzymes. So let's talk about the advanced stage or the advanced signs of fatty liver disease. But yellowing skin, that's because of jaundice. 2, you get abdominal swelling and ascites, and it's hard. It's big, right? And that's called, the medical term for that is ascites. And it is, your belly is distended, okay? And then as a result of that, that big portal vein is going to get backed up. That's the big vein leaving the liver. And it's going to, what you're going to see then is bilateral, meaning leg swelling, both sides, okay? You'll get confusion and memory issues, easily bruising and bleeding, and itchy skin and spider-like veins. So how can we formally diagnose NAFLD? Your liver enzymes like the AST, ALT, GGT can be totally normal even if your liver is fatty. So that, I would say, was my case. My liver enzymes weren't always normal, yet during my pregnancy, so my first pregnancy, I was 28. And for me, they just picked it up on ultrasound. But I'm happy to report today I no longer have fatty liver. But the ultrasound can pick it up. There's a specific scan called a fibroscan, and that's what picks up the scar tissue. What we really want to avoid when you have chronic inflammation, and again, I'm going to really recommend that you watch that inflammation video. I'll link it at the end. When inflammation is chronic, and in the physical therapy world, which I'm a physical therapist, we say anything past 21 days, that's chronic inflammation. And no cell can heal as long as it's inflamed. Okay? It's not well then. And the acute inflammation is supposed to come and prepare, clean up any damage, and then prepare that area to heal. But if you keep re-injuring it, then you will continuously have inflammation and you won't heal. And eventually, instead of that cell recovering or that cell being replaced with a new cell, it's going to be replaced with scar tissue. And so that fibroscan is looking for scar tissue. And then also an MRI could help diagnose it. And in some cases, like in my brother's case, they did a liver biopsy because he was so young and his numbers were so high. So that's really the gold standard. But that doesn't come without risks. It's a procedure, and certainly I wouldn't want to have one if I didn't have to. But they're going to confirm that it's fatty liver, and sometimes to help really diagnose what stage are you. Stage 1? Are you near cirrhosis? So or are you more advanced? The first stage is steatosis, and that's just some simple fat buildup. And believe it or not, just switching to what I do, a low carb, and I particularly do a ketogenic diet. But even if you went to just whole foods, that would make you might not have to, if you're young, you might not have to drop your carbs really low. But getting rid of processed food and seed oils are huge. So that fatty liver can be reversed. Stage 2 is called NASH, non-alcoholic steatosis hepatitis. Okay, now you have inflammation of the liver cells. They are starting to show damage. Okay, you're still reversible here, but now you better take heed and take warning, because now that your inflammation is becoming chronic, you really need to make lifestyle changes now. The third phase is fibrosis, and that's when scarring begins. So that means you've had inflammation for quite a while. And now, if the liver is actually very forgiving and can regenerate. It's one of the organs that really regenerates. But once it's replaced, that liver cell is replaced with scar tissue, you just lost part of the liver that's going to do the job. Okay, scar tissue doesn't have the differentiation, meaning all the capabilities of a liver cell. It actually has none. And then if that continues to progress, and again, this happens with NAFLD, non-alcoholic, and alcoholic fatty liver disease. The same things happen. It's just, again, the difference between the root cause. One is sugar and high carbohydrate diet, and one is alcohol, which alcohol has carbs as well. So if you get cirrhosis, that's irreversible scarring. And I would say some point the fibrosis starts to get irreversible too. When you start laying down scar tissue, it's done. So finally, they add another stage, which is a liver cancer. And your risk dramatically rises if you have cirrhosis. The top culprits are sugary drinks, high fructose corn syrup, refined carbs. Seed oils like soybean oil, corn oil, cottonseed oil, rapeseed oil. I do have a video, best fats, worst fats, for the ketogenic diet. I will link that video at the end too, because they're very inflammatory. And so in combination with those and the sugar, you're really going to progress the disease. And if you add alcohol on top of it, maybe you're not an alcoholic, I'm not saying that, but if you already have fatty liver disease from your diet, but you're also taking on, maybe it's casually, but you're adding alcohol to it, that's just making things worse. Okay, I'm not saying you have a drinking problem, but if it was caused by your food and then you're ingesting, a beer because you're out for pizza that day, boy, that's going to make it worse. So I want you to think about that as well. So usually if it comes in a bottle or a package, your liver's probably not going to be a fan of that food because it's processed. So how do we reverse it? Or how do we, if you do have some scar tissue in there, how do we stop it where it's at so it doesn't continue to get worse? One, and again, I want to remind you that the liver is remarkably regenerative. And if you give it the right inputs, it can heal. So you cut out fructose and refined carbs. So something is, and think about if you have little kids too, like in the summertime in those fruit, like those icy pops, loaded with fructose corn syrup. They put it in kids' yogurts. So oh boy, that's what makes me really mad, right? They're setting these kids up to be um, uh, little sugar addicts, if you will, because high fructose corn syrup really rings that dopamine bell. You also want to ditch the inflammatory seed oils, eat real whole foods, exercise, even walking helps, especially after your meals. It'll use up the glucose in your bloodstream, lower your insulin. And then just believe it or not, a 5 to 10% weight loss can really make a big impact on your liver. Now, if you adopt a low carb lifestyle, a ketogenic, carnivore, ketovore diet, don't recommend doing this right away, but intermittent fasting can really do a great service to your liver. It gives your liver a break. So it helps to drop insulin, promotes autophagy, and autophagy is just the process where our body, when we're not eating and when we're sleeping at night, so don't eat 3 hours before bed. And that was my hardest thing because I'm sitting down at night watching TV. Even if I'm eating good food, I'm eating too close to bedtime. So when autophagy would normally be occurring while we're sleeping and recovering and cleaning up all the dead cells and replacing it with new cells, it's too busy digesting food. There are a few other things that I think it's important to mention, and that's for liver health are supplements. Some that have been pretty tested and showed um, some promise and positive changes with liver health. One is berberine, and it acts like metformin without a prescription, and that's been around a long time. So some people take that. Milk thistle has been around. I know about it for over 30 some years, and it's an antioxidant that supports liver regeneration. Choline helps move fat out of the liver, and guess what food really has a lot of choline? Eggs. And we thought eggs were bad for us, but really they're good. I have eggs every single day. I used to hate eggs. I love eggs now. Omega-3s, they are anti-inflammatory and they help lower triglycerides. And vitamin E, which not everyone should just take vitamin E. I think you should consult or do that with supervision. First of all, the ketogenic diet is low carbohydrates, right? So that's going to help improve insulin resistance. It's high fat, and when done right, it can be very powerful in reversing NAFLD. So here's why. It drops insulin. It halts fat production in the liver because you're not giving it a lot of sugar. So your liver's not making a lot of triglycerides. It Once you get on the ketogenic diet, then it allows you to burn up all that fat that's stored in your liver that shouldn't be there, and you can burn that for energy. And then also you'll start burning the fat on your body. It also improves blood sugar, triglycerides, and that good cholesterol, the HDL, goes up. So studies confirm that the ketogenic diet doesn't just stop NAFLD, it can reverse it. And that is true in my case. Um, I want you to really hear me that you can reverse this and you can heal your liver. It's amazingly very forgiving for what we put it through. However, NAFLD comes on very subtly. It's insidious. Like the signs are not really glaring, and it can be under siege for many, many years. But it's also one of the most reversible conditions that we face today. And I just think if we started talking about it more, if physicians started looking for it, and they might say, oh, well, this person's going to have fatty liver disease. Oh, don't have any more alcohol. Don't do this. But what about the processed food? What about the high fructose corn syrup? they need to tell everybody that. People need to understand what food is doing to us. And the great thing about this is you can reverse it without any medications. I didn't take any medications to reverse my NAFLD. I used food, and I'm fueling my body with real, nourishing, whole foods that my body could use. I also move my body, I exercise, and I also intermittent fast every day. I let my liver have a healing part of the day and the rest of my body so it can repair. And remember, your liver isn't just a filter, it's your metabolic powerhouse. So if you're struggling losing weight, the ketogenic diet helps you lose weight, and it helps your liver as well, and it helps to reverse insulin resistance. So by listening to your body's signals now, you can prevent serious problems later. Again, I'm going to ask you to go ahead and pull some of that old blood work and check out and see how high your triglycerides are. So healing is possible, and it starts with what you put on the plate. So the liver doesn't really complain a whole lot until it's too late and you start having some of that scar tissue. I hope I provided you with some scientific information and some understanding about how important the liver is and how important it is to keep healthy and how it's related to metabolic syndrome and insulin resistance and type 2 diabetes. This channel is dedicated to teaching everyone how to improve their health through a sustainable low-carb diet. Consider subscribing. This is a new channel, and I'm trying to get the word out, and I'm trying to give you the information you need to ask the right questions when you go to your doctor's office. Okay, thank you. I'll see you in the next video.